Being a veterinarian means I get to be happy. It means I get to enjoy what I do every day. I get to get up and come to work knowing that I am going to help animals and help their owners, and hopefully bring healing and health. And it means educating and teaching people about the best way to help their animals. We look at things from a different perspective. Whereas your traditional veterinarian may be trying to sell prescription diets or have you feed foods that come from big box stores, we work very closely to tailor each diet to each specific animal, whether that be home cooked, raw, high quality canned or dry food, but we want to make sure that each diet fits each individual animal. Howdy, welcome to webinar number 11. I'm Dr. Judy Morgan if this is your first time tuning in. And we have holistic veterinary practices in Clayton and Pennsville, New Jersey. And so we're continuing with our Food is the Foundation of Life webinar series, and today is number 11, believe it or not. And today we're going to talk about feeding diabetics. I know we didn't let you know what we were going to talk about this week, and this is probably a fairly popular topic because there are a lot of diabetic pets out there, and we are seeing more and more of it, so it's a little bit scary, but we're seeing more and more because of the way pets are being fed. So it's true, you are what you eat, and we're going to talk about what to eat to solve this problem. So we always talk about what is real food, and particularly when we're dealing with diabetics, we need to get down to real food. Processed food is not going to work very well for diabetics, and that goes for human diabetics as well as pet diabetics. So we want fresh fruits and vegetables, we want organic, we want locally sourced, we want fresh meats, we want grass-fed, not feedlot fed or confinement operation, we want no antibiotics and no GMO grains fed to those animals, and that can be really hard to track down, so you do the best you can with that. And whole grains are going to be very, very important for these animals, not things that are processed. So when we talk about the different pet food formulations, there are some foods that we are really, really not going to want to feed to diabetic pets. So we've gone through these in past webinars. The semi-moist food is loaded with sugar. It doesn't have a place in any pet's diet, but particularly in diabetic pets. This is just a curse for them. All the sugars in there. You'll never regulate their blood sugar. You'll never get their insulin levels correct. So semi-moist is just out the window for these guys. I do not like dry food in general, but I really do not like dry food for diabetics because it's a processed food and it's going to cause a lot of the problems that we're going to talk about that diabetics have. The refrigerated rolls can be good depending on the ingredients, so you're going to have to be an ingredient reader. And the same with the canned foods. They can be excellent for diabetic pets, but you need to be careful that you're not getting white rice and glutens and some of those sticky substances in there that are going to raise the blood sugar of the pet, and we'll get into that a little later. Home cooked, you can do a great job home cooking for these pets, and raw food, you can do a great job with raw food for these pets. Treats and snacks, you need to consider those and be very careful when you're dealing with diabetics, because you can have the best planned diet in the world and you can totally ruin it by feeding the wrong treats or snacks. Read ingredients, make sure that you're not feeding things that are loaded with processed carbohydrates and sugars, because that's going to throw the whole ball game out of whack. So what is diabetes? There's actually a couple of forms of diabetes, and we are going to talk about today diabetes mellitus, which is the one that has to do with blood sugar. So diabetes is a disorder of carbohydrate metabolism, and it can be due to decreased production of insulin by the pancreas or an inability of the tissues to use the insulin that's produced. So we can see it either way. Pets most commonly have a form of diabetes that resembles type 2 diabetes in people. Juvenile diabetes, which is type 1, is fairly rare in animals. I can only think of one animal in my practice in 30 years that had juvenile diabetes. It actually took us quite a while to get to that diagnosis because it's so rare. The pet was only 4 months old and it was drinking and urinating and drinking and urinating. And the pet did go on to live a very normal, happy life, but that pet started out very, very young with diabetes. So what causes it? Well, excessive intake of carbohydrates, sugars, and fats. And so we've talked about the highly processed dry foods, and some of them have sugars, and we shouldn't be feeding those anyway. But they're highly processed and they're loaded with carbohydrates. Even a grain-free dry food is going to have a lot of carbohydrate in it. And there's a lot of foods that are made with rice or corn as some of the main ingredients, and those are fairly good at raising blood sugar. So we really want to avoid those. And, you know, if pets are fed, particularly dogs and cats that are fed free choice dry food, they get obese. Their blood sugar is going up and down all the time. And very, very many of those pets will become diabetic. These are the gluttons. These are the guys that you fill that big bowl of dry food and they may not sit and eat it all at once, but over the course of the day, they're going to eat probably twice what their calorie intake should be. And these are the people that aren't measuring. They say, I'm giving 1 cup. And then when I ask them what size cup, because a cup is 8 ounces, they go, you know, that big gulp cup from Wawa. That's not a cup, folks. That's far from it. So, and certainly feeding your pets a lot of sugars, candies, that sort of thing, which are not good for them anyway. High fat diets can cause some issues as well. And the reason those high-fat diets can cause issues is because they can lead to pancreatitis. So there are some pets, particularly cats, that are just kind of chronic, not doing well. You know, they're kind of fat, their appetite goes up and down, they kind of vomit randomly, intermittently, they get intermittent bouts of diarrhea, and a lot of those cats, when we ultrasound them, we find that they actually have chronic pancreatitis, and so there's chronic inflammation there. And pancreatitis in cats is very difficult to diagnose with anything other than ultrasound. We can do blood tests, but they are not that specific, particularly for the kitty cats. Can be a little more specific in dogs, but can still be sometimes hard to pinpoint without that ultrasound. So the pancreas can be damaged, and the pancreas holds the cells that make insulin for the body. So if the pancreas is damaged from chronic inflammation or from one big bout of pancreatitis, it can't produce as much insulin, and so your sugar in your body can't be regulated very well. So from a Chinese medicine standpoint, stress, anxiety, excessive emotional disturbance can also lead to diabetes. So a lot of these pets are the ones that they eat all day because there's food available all day, but they don't go out and get exercise. They don't have as much human interaction. A lot of times these are the clients who work very long hours, so they leave food available for the pet thinking, well, you know, I'm not going to get home till late tonight, so I want to make sure that there's something there. And that's fine, but a lot of times these dogs also have some anxiety because they're alone for long periods of time, and they may be fairly frustrated because they can't control their environment and what's going on around them. So spleen Qi deficiency, we've talked about this before. The spleen can be overwhelmed by poor diet, particularly that highly processed, damp-causing dry food, and it's unable to process the food correctly. So that results in obesity, and when they get very overweight, then they become fatigued more easily, and they have muscle wasting because they're not moving around as much. So the muscles are not near what they were. And the spleen is in charge of muscles. So if you don't have good spleen function and you don't have good spleen Qi, you're not going to have good muscle function. So yin deficiency, again, these highly processed dry foods. Not enough moisture in the body, not enough cooling in the body. So there's internal heat, consumes the moisture in the body, causes wasting and thirsting. So from a Chinese medicine standpoint, diabetes is a wasting and thirsting disease. What are the symptoms of diabetes? These guys drink and urinate like nobody's business. And so that's kind of the first thing that, you know, people come in and they say, oh, suddenly my cat is drinking and drinking and drinking. My dog's having accidents in the house. She's never done that before. And people do know enough to know that those are symptoms of diabetes. So everybody comes in and says, I want my dog tested for, or my cat tested for diabetes because he's drinking and urinating more. And it probably is one of the biggest causes. Unfortunately, particularly in the kitty cats, kidney failure in old age is another big cause, as well as hyperthyroidism. Excessive use of steroids like prednisone or dexamethasone. There are some practices that if steroids were taken off the market, there are some veterinarians that if steroids were taken off the market, they wouldn't be able to treat anything because this is their number one go-to drug. And, you know, prednisone and steroids fix a lot of things. They will stop dogs from scratching. They will stop dogs from coughing. They sometimes can stop cats from peeing. They can fix a lot of different things, but they're not really fixing. They're hiding symptoms and they're causing other problems. So particularly with long-term use of steroids, we start to get changes in the liver. And then we get changes in digestion, changes in the kidneys. And that's what causes these guys to become diabetic over time. And their pancreas is chronically being bombarded. So steroids are not, sometimes they're an easy fix, but they're not a good fix. With that said, for animals who have an overactive immune system, the ones who are killing off their own red blood cells, killing off their own platelets, sometimes this is the thing that saves their life. And I do have people that bring their pets to me that have been on high doses of steroids because they had an autoimmune problem where they're killing off their red blood cells or their platelets, and they would die without the steroids. But their goal is to get their pet off steroids. And with quite a few of these animals, we have been very successful using herbals and diet changes, getting them off those steroids, because we don't want to keep them on the steroids and then have them die of liver failure or diabetes. You know, you fix one thing and cause 3 other things. So, you know, if in doubt, say no to steroids. So, symptoms of diabetes: sluggishness, lethargy, easily fatigued. We talked about the muscles don't get the food that they need to grow and to work. They don't have good chi, and so there is fatigue and sluggishness. And these pets are usually obese, so that's going to increase the sluggishness. They are thirsty, 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 thirsty. These guys will go through buckets of water. They are hungry. They would eat anything they can get. These are the guys who are stealing everything off the counter. They're going through the trash cans. You leave something out, they're guaranteed to get it. They go to the neighbor's house and steal everything they can over there. They're going through the trash cans. These guys are thirsty and hungry. And when you drink more, obviously, you're going to pee more. Oh, did I go the wrong way? Yeah, I did. Sorry. Oh, sorry. That should say diabetes, not dampness. Didn't change that. Obesity. So these animals will get overweight because their spleen is not processing the food correctly or properly. And so they are going to become overweight and they're going to store fat. And once the diabetes becomes very symptomatic, and by the time you figure out that they're probably diabetic because they're drinking and urinating so much, then they're going to start losing weight. I have one client in my practice, her dog has been diabetic for over a year and she absolutely refuses to treat this dog. And I think the only reason the dog is still alive is that she is home cooking and she's cooking a really, really nice diet for this dog. Dog should have been dead a long time ago. Blood sugars are still above 400. Normal is 80 to 120. The dog looks pretty awful, but he's still alive and he shouldn't be. So if you have a really fat dog or cat and, you know, you kind of turn around one day and go, boy, he looks like he lost some weight. Geez, you know, come to think of it, he's been drinking a lot too. You probably have a diabetic. And by the time they're starting to lose weight, they're starting to get pretty sick. So need to get them in. So this is a disease where they've got too much heat and they're too dry. So the tongue is usually going to be red and dry, depending on the stage of the disease. Remember way back when we talked about yin deficiency and the energetics of pets, and these guys don't have enough moisture, so the tongue will be dry, and they're usually hot. They pant a lot. They're trying to drink to cool down, so you're going to see that redness. Other symptoms: increased risk of urinary tract infections and skin infections, particularly yeast infections. These pets have high sugar in the blood, and they also have high sugar in the urine. And bacteria and yeast love to grow on sugar. You know, think about you're making a loaf of bread, and so you put the yeast in there, and then you add a little bit of sugar with your flour, and it grows, and it poofs all up, and it gets very active, and the yeast is very happy in that situation. So you'll get the same thing in the skin and in the urine and in the ears. These guys are kind of a nightmare with infections, and you know, these are clients with diabetics, particularly diabetics who are not well managed, will come in complaining all the time that, you know, the dog's peeing all over again. There's blood in the urine. He's itchy. You know, the skin smells. The ears smell. Again, it's a nightmare. But if you manage it correctly and get this pet to have a normal blood sugar of 80 to 120 most of the time, most of this stuff will clear up. With that said, I do recommend that diabetic pets have a urine culture run every 3 to 4 months because many of them, even if they're not symptomatic, are growing bacteria in their urine. So excessive panting, these guys are hot. There's that red dry tongue. These guys are hot, and part of the drinking is they're trying to cool off. They've got that yin deficiency, so they're trying to cool and moisturize. Cataracts. So sometimes the way that we get to the diagnosis of diabetes is because the owner hasn't noticed that the dog is overweight and losing, you know, and starting to lose weight. They haven't noticed that the dog drinks a lot and is urinating a lot. He's always drank a lot. But they come in and go, yeah, what's that white thing in his eye? And he's got a cataract. So cataracts, because of changes in liver metabolism, will develop secondary to diabetes. Most of these pets do have good vision behind the cataract. They can see around the cataracts for a while. And so we do end up sending a lot of diabetic pets to have cataracts removed with the ophthalmologist. They can sort of be dissolved. It takes a long time and it doesn't work really well, or at least I haven't had great success with it yet. Still working on it. Okay, so after we've got the obesity and the drinking and urinating, it will progress to lack of appetite if not treated. They'll start to vomit, and then they become ketoacidotic, which means they've got ketones in their blood and in their urine, and that's when they develop coma. So these are dogs whose blood sugar has been or cats, their blood sugar has been so high for so long that it affects the brain, and they'll actually become comatose. And those guys are critical and hard to get turned around. It can also, if left untreated, cause peripheral neuropathy. So big words. What it means is that the nerves, when we get out to the end of the nerves, so when we get down to the hands and the feet and the lower limbs, the nerves don't function very well. In humans, this is commonly what causes gangrene and the loss of fingers and toes. We don't see that very often in pets as far as the gangrene, but we will have particularly cats that haven't been diagnosed and have progressed in their disease. And when they bring them in, they're walking very low on the hind legs. They're actually walking all the way down on their hocks, which is that joint that kind of bends backwards. And it's really not normal for an animal to walk that way, and that one is a wake-up call. When people see that, they kind of figure something's going on. That, you know, diabetes may not be the first thing in their mind. And we don't get too many of these, but I have seen quite a few. When you get these animals treated over a long period of time, they can come back up and walk on their feet, but it takes a long time. So how are we going to treat this? Well, we already said it's a yin deficiency, so we're going to feed foods that include yin tonics, so that's going to be cooling and moisturizing. And if you go back to webinar number 4, you can review yin tonics. So I put a few of them up here. As far as the meats, it's going to be turkey, duck, rabbit, alligator, whitefish, alligator for you folks in Florida, and barley, brown rice, millet, tofu, and wheat flour. And, you know, I leave the wheat flour in there because it is cooling and it's a yin tonic. Most of us kind of, you know, do the, oh, wheat is awful, dogs can't have wheat. And that's not true. Whole wheat is actually fine, just like it is for us, unless the pet has a wheat allergy. Apples, bananas, blueberries, mango, so watermelon, those are all yin tonics. Broccoli, celery, cucumber, kelp, mushroom, spinach, radishes, tomatoes, those are going to be the veggies that we're going to be able to use for these guys. Okay, So we want to feed foods with a low glycemic value. So we've already said we're not going to use dry dog food for these guys. So we either have to read the label of the canned food or the refrigerated roll or the raw diet, or we're going to make our own. So we want to stick with low glycemic value. So what's glycemic index? Well, it measures how quickly a food can raise the blood sugar levels. So glucose, which is sugar, has a score of 100, and everything is compared to that. And the preparation of the food, we talked way back at the beginning about how preparation can change energetics of food. It can also change the glycemic index. So a boiled white potato is going to have a glycemic index around 87, which is pretty high. It's pretty close to sugar. A baked white potato is going to have a glycemic index of 111. So, feeding yourself or your pet a baked white potato is more sugar than eating a spoonful of sugar. So that's why they say to avoid those white things. So foods with low glycemic value, and these are partial lists. I tried to pick some things that we might think about using when we're cooking for pets, but you can Google glycemic index on the internet and you will find more complete lists, more so for humans, but it's going to be very, very similar in animals. So you can use those lists. And if you are a diabetic or someone in your family is diabetic, these glycemic value lists can be very, very, very helpful in managing your diabetes and keeping things under control. So, foods with low glycemic value: alfalfa, almost all kinds of beans. Beans are pretty darn good. Most of them are going to have a glycemic value less than 50. Asparagus, celery, string beans, some of the green vegetables, they're all going to be very, very, very low. When we're looking for grains to make a diet, if we're home cooking and we want to, add some calories, fill it up a little bit, barley is your best bet. Barley's glycemic index is something like 30. It's very, very low. And if you remember from webinars previously, we talked about barley because it is cooling and draining. So it's going to help cool the pet. It's going to help fill them up, and it's not going to raise that blood sugar. I really like barley. It's one of my favorite grains to use if I'm going to do crock-pot cooking. Whole wheat pasta. So this is where we talked about, wheat flour can be okay. So whole wheat pastas are good. And it's interesting because when I was looking at glycemic index lists, spaghetti was higher than macaronis. Now, how the shape of the pasta changes it, I don't know. But they're all made with the same stuff. So I just thought that was kind of interesting. Whole oats. Very, very good. So a lot of these diabetic pets who maybe aren't eating very well, a bowl of oatmeal in the morning, and we're talking whole oats. So around here we use steel cut oats. Very, very good. You do not want to be using quick oats because the glycemic index on those guys is closer to 100. But the whole oats are going to be very low, and so a little bowl of oatmeal in the morning for these guys can be really good. Carrots, as vegetables go, they're a little bit up there, but they're still like a 30. So they're okay. We can put carrots in our stew. Most of the squashes are going to be great. The green squashes, are like the summer squash, are going to have a lower glycemic index than the orange, like the acorn and the butternut squash, but they're all still fine. Tomatoes, great low glycemic value. Right now we've got cherry tomatoes growing in our yard, and I've got spaniels out there eating tomatoes right and left, so they like them. You can put them in their stews. So we're looking for some treats. Well, apples and pears. Oh, I've got barley in there twice. Apples and pears, so you can feed slices of those. When I cook a stew, I like to cut up apples and pears and put them in the stew, particularly if I'm trying to drain some phlegm. Those guys are really good, and they taste really good. Turnips, so you want something to replace the white potatoes, use turnips. They cook up about the same. They're very, very low glycemic value. They taste pretty good. And most dogs will eat them, no problem. Quinoa is moderate. Its glycemic index is about 50 to 60. So definitely higher than barley, but much lower than rice. So quinoa is an alternative to the barley. Chickpeas, extremely low. I think the glycemic index was something like 12. And there are some diets out there that, you know, the grain-free diets, and they're using chickpeas as a replacement for the grains in those diets because they need something to make it all stick together. So chickpeas are actually fine. Green peas, on the other hand, have a glycemic value of about 65, so they're going to be higher. Not that they're out of the realm of being fed, but they're going to be a little bit higher, and I think there's a lot of other things you could put in the stew other than the green peas that would fill the bowl and make your pet happy and satisfied. And it's interesting because with the cans of Merrick that have the whole peas in them, the peas are usually the last thing that get eaten. Our dogs eat everything in their bowl, but I look in there and the peas are kind of the last thing to go. So we want to avoid foods with high glycemic values. So we already talked about those white potatoes. Boy, those guys are pretty deadly. White rice is really deadly as well. And so this is another complaint about those dry dog foods. Many of them use white rice because it is inexpensive, a good filler, but it's got a high glycemic value. So we've got these dogs who are prone to diabetes. They're being fed a processed, heat processed food that's going to make them more prone to being diabetic anyway. And then we use things like rice in there or white potatoes in there, and it just keeps making the situation worse and worse. So white bread, you know, and this is in the human world with diabetics, we always say just avoid anything white. So here you go, white rice, white potatoes, white bread. So all of those things are going to raise the glycemic value. When we're looking at fruits, melons and pineapple are going to be pretty high. So watermelon and honeydew are some of my favorite things for cooling pets off in the summer. However, these pets would probably be better off being given slices of apple or pear or radish. They're going to be cooling instead of the melon and pineapple because they are pretty high in the sugar category. So just like with everything else, and particularly with these diabetics, because they've got weak muscles, most of them are overweight. We need to get them moving. We need to get them exercising and start slow. Think about yourself. If you're carrying an extra 30% of your body weight around, you do not want to be drug around the block for 3 miles on your first day out. You're going to kill the poor guys. If you have kitty cats that are really obese, start with some really simple stuff. Teeny tiny bit of laser tag, throw a little ball or a squeaky mouse or whatever they like, but don't overdo it. But we do need to get these guys moving, and as their muscles get stronger because their diet gets better, things will improve, and then they'll be able to exercise more. Avoid foods that cause cold and damp and injure the spleen. So we've talked about these a couple of times before. Dairy products, dry or highly processed pet foods, refined grains, that's those white breads, the carbohydrates, sugars, and cold foods. Because remember, cold damages the spleen. So if you are feeding a frozen raw, you need to warm it up to room temperature. Add some hot water, let it sit out for a little bit, however it is that you're going to bring it up to room body temperature before feeding. Again, we want to keep the bowel healthy with good intestinal flora because we want to make digestion easy. So probiotics, happy little guys. Although he doesn't look very happy. Keep the bowel healthy and make the work of digestion easier with digestive enzymes. Again, that depends on what you're feeding, but digestive enzymes could be very helpful for these guys as well. Now, with all of this said, is all of this going to allow us to get our pets off insulin? Because in animals, insulin is really the only way to treat diabetics. And that is pretty daunting for most people when they hear that right off the bat. I'm going to have to give my dog a shot twice a day. I'm going to have to give my cat, which is all teeth and nails, a shot once or twice a day. Pretty scary. Here's the good news. The needles are teeny, teeny, tiny, and your veterinarian or the veterinarian staff needs to work with you and make sure that you feel comfortable giving these injections, and also work with you knowing what to look for. If your dog has blood sugar that gets too low after you give an insulin injection, they're going to get weak and wobbly. That's the time you want to give them something high, with a high glycemic value. Feed them a potato, feed them a slice of bread, feed them some Karo syrup. You've got to get the sugar back up. If you can monitor blood sugars at home with a glucometer, and you can use the human glucometers, there are specific ones made for animals. The human ones work pretty well. Because you're looking for comparison. You know, if you know that normal for your dog on the glucometer that you're using is 135, and you take a reading and it's 52, well, we're low. So you know you've got to get something into them. So as long as you're being consistent with the machine that you're using, it's fine. And blood sugars, you know, for human diabetics, people have learned it takes a quarter drop of blood. It is so tiny. Good places to get that on dogs and cats is along the edge of the ear margin. There's little veins there, and you can just poke them with a very small needle and get enough blood to test. So it's really pretty simple. So if we change the diet and we do all of these things to make this animal healthier, are we going to get rid of insulin? Probably not. For cats, good chance that you will. Many cats will, particularly if they're being fed a high carbohydrate diet when they're diagnosed, if you just get those carbs out and get them on a low glycemic diet and put them on what cats are supposed to be eating, which is meat, many cats will become not diabetic, and then you can get away from giving them insulin shots. Now, with that said, there are some cats that kind of bounce in and out, so they'll be good for a couple of months, and then they'll need a little bit of insulin for a couple of months, and then they'll be good for a couple of months. But you need to do everything you can to make their life easier and to make them need less insulin. So for dogs, we had adopted in the picture... Let's find it there. So that little min pin in the picture was a diabetic, and he belonged to some older people that were clients, and they fed him some really bad dry food, and he got very obese. And so they were kind enough to agree to give him the insulin injections, but they couldn't home cook and they wouldn't switch the food. And they said canned food was too expensive. Now, this is where I kind of have to shake my head and go, yeah, but if we're using less insulin and less trips to the veterinarian, and the dog feels better, doesn't the canned food pay for itself? Anyway, but you can see he's got cataracts in both eyes. That's what those white eyeballs are. He's got cataracts. He was pretty blind. And he came to us, and he was on 13 units of insulin twice a day. And he was on dry food. So we switched his diet. And I said, okay, well, we're going to switch the diet, so he's going to need less insulin. So I think I dropped him from 13 down to 9 or 10. And after a couple of days of that, he started to have seizures. And when I say he started to have seizures, I mean he started and didn't stop. And so here we are, 10 o'clock one night. This dog is seizuring. I'm giving him Karo syrup. We can't get his blood sugar up. We go to the clinic, put him on an IV sugar drip, and laid there on the floor with that guy all night, just getting sugar into him to get his blood sugar back up. So he came to us with an insulin requirement of 13 units twice a day. By the time we got everything straightened out and got him on, we started feeding him the frozen raw, he needed 3 units twice a day. That's a huge difference. And he felt great, and he was pretty funny. He wasn't completely blind, and when his blood sugar would get high, he couldn't see. So we could tell when his blood sugar was high based on if he was bumping into the walls or falling in the pool. And when his blood sugar was normal, he could see enough to get around and not get in any trouble. So that was the first diabetic dog that I've owned, and that was, it was great to really have firsthand experience and really learn. So when I have clients who are willing to do the switch, I can't emphasize enough that you need to back off on that insulin. If you don't have a glucometer at home, you need to work very closely with your veterinarian, and it is going to require trips in probably every day to get a blood sugar taken to know where you are, because you don't want to drop them too fast. It's life-threatening. It's scary. You'd be better to underdose for a few days with your insulin, and then you can always go back up. So diabetes is it can be very confusing to people. What's blood sugar, what's high blood sugar, what's low blood sugar, what are the symptoms of both. You do need to work closely with your veterinarian. If someone in the family is diabetic, then you have more knowledge about it, and I find that happens very commonly. But it definitely is a disease that can be managed, and these guys can feel great and live really normal lifespans. So, and for those of you who don't have diabetic pets and you want to prevent your pet from becoming diabetic, the easiest way to do that is don't make them fat. So, thinking we probably have some questions.
We've got a couple. First one, would cranberry supplements be good to help with infection in the kidneys?
Would cranberry supplements be good to help with infection in the kidneys? Yeah, we get bladder and kidney infections, so basically urinary tract infections, and cranberry can be very helpful. And cranberry doesn't, straight cranberries do not have a high glycemic index at all. The cranberry juice cocktail is just god-awful because it's got high fructose corn syrup, so don't use that. But there are great cranberry supplements, or you can add cranberries to the diet. They're pretty bitter. I don't know if your dogs are going to eat them raw. But if you're cooking a stew and you want to throw them in, you can. But that could be very helpful.
Can barley cause ear allergies?
Can barley cause ear allergies? Only if your dog is allergic to barley, which is pretty uncommon because it's cooling and draining. It is not high on the hit list for allergens. So I would feel pretty comfortable feeding barley.
Would you recommend digestive enzymes and probiotics every day if you feed raw for breakfast and Merrick canned at dinner?
Do I recommend probiotics and digestive enzymes every day if raw is fed for breakfast and Merrick canned is fed for dinner? Well, that's a good question because at our house we have some that eat Merrick canned and some that eat raw. Everybody gets probiotics every day. But I only do them once a day, and that's just for good gut health. I don't do digestive enzymes all the time, and I don't know, maybe it's because I'm a little bit lazy. I think that they're good, and they certainly could be incorporated into every pet's diet. But with that said, if you have animals who are digesting well, you probably don't need to add them. For the pets that are on raw food, there are some natural enzymes in the food, so it kind of depends how, and in raw, the food's really not processed. If you're feeding a frozen raw, we're killing off some of the enzymes, but there's still some there. If you have a dog who's having problems digesting, you've got any diarrhea issues, you've got belching, burping, vomiting, yeah, add enzymes. You don't have a nice solid stool, add enzymes.
And last one, do you recommend snacks for diabetic dogs?
Oh, do I recommend snacks for diabetic dogs? Sure, you can give snacks to your diabetics. Make sure they're low glycemic value. So string beans, great. Most dogs will actually eat string beans. They'll eat a piece of apple. They'll eat a piece of pear. They'll eat a piece of carrot. Those sorts of things are great. If you can, let's see. We have Pure Bites that we use, which are just dehydrated beef liver. And they also have dehydrated chicken breast. So something like that would also be excellent for these guys because it's not going to raise their blood sugar enough for things to be a problem. These dogs and cats must be fed twice a day. And some of them probably could stand 3 meals a day, just depending on how you're doing things. But, the goal is to keep the blood sugar as steady as possible throughout the day. Okay, so next week we are not here because my production crew is going to California. So, lucky them. So we will not be here next week. I am hoping the following week to maybe have some cooking videos. If not, the next thing on the list might be cancer. Not sure. So, but anyway, we will post it and we'll let you know. And in the meantime, have a great couple of weeks. We'll see you when we're back.
Thank you for joining us for our food webinar. Remember to follow us on all of our social media on Facebook and Twitter at Clayton Vet NJ. That's Clayton Vet NJ. Remember to visit our website as well for more information about how you can help your pet live a healthier lifestyle. Make sure you join us next week for the next installment